another episode of BDA Baby. This was a really popular one, which is not surprising to me because whenever we talk about things like postpartum depression or postpartum anxiety, those always seem to get a ton of questions submitted, and also a lot of people just wanting to learn more about it and feeling like they can finally ask questions about what they might be experiencing currently. So I'm thrilled that we will be talking to Dr. Sarah about postpartum depression, postpartum anxiety, and also just hormones in general, because it's such a huge space, such a complicated space, and one that I think we need to be talking more about because it's a very challenging one for so many people. So I'll bring her on, and thank you for the artwork behind me is Carrie Rosenthal. So I love it. Okay, so let's go to, and thank you to really nice. I'm embracing it before it's just gonna fall out. Postpartum again. Help me. How are you?
Good. Thank you.
I'm so happy that we're doing this because I got a huge flood of questions all about everything that we want to talk about today. And it just shows me, which I'm sure you see all the time, just how big and important this subject is, especially with the whole subject of just hormones. And, you know, when you're pregnant, you have all these nicer hormones that, you know, give you things like a lot of hair or glowy skin, or just make you, you know, feel good. And then talking just about the whole postpartum period, which is such a under discussed space in general, but I think especially obviously the depression, anxiety, isolation, and just hormonal parts. So I'm really excited to launch into it with you.
Awesome.
I want to first talk, because I know I addressed you yesterday when we were talking about this conversation we were going to have as a fertility psychiatrist. So can you explain a little bit about what that is? Because I feel like that's such a important thing to be able to have in the fertility journey.
Yeah, so reproductive psychiatry is a relatively new field. It's really based out of the fact that a lot of general psychiatrists and in really good training programs, whenever we would see pregnant people, it'd be like, not sure what to do, maybe take her off of all her medications. I'm not sure what, really a lack of data, unfortunately, in pregnancy and in the postpartum is also sort of what spurred this whole field to really get started. So I really focus on female reproductive hormones and how they impact mental health. And that can actually start from your first menstrual period all the way to menopause. But pregnancy and postpartum, like you said, are one of the times where female hormones sort of increase the most and decrease the most. And actually, you mentioned something really wonderful, which is that sometimes the female reproductive hormones can agree with you during pregnancy, hence the glowing skin and the hair. But actually, for some people, that's the time where perinatal mood and anxiety symptoms start. And that's really important to talk about, that 50% of postpartum mood and anxiety disorders actually start during pregnancy.
Wow. And at what phase during pregnancy do those start?
So it's all over the place. But, generally, I think it can actually start in the first trimester when you have all of those terrible symptoms of nausea. And for some people, the nausea can become so debilitating. And I think that's also not talked about so much, right? We talk about hyperemesis gravidarum, and that's if you're throwing up all the time, but there's more of a spectrum, and even just nausea that's sort of constant and all day, really not morning sickness people, it's all day long. For some can start to sort of bring up some of these mood symptoms. And of course, if someone has a history of depression or anxiety, then that can also be pregnancy can be a vulnerable time for them as well.
So for a lot of the people who, and I have friends who've also experienced this, when you do become pregnant, if you do have a history of depression or anxiety, and I think you mentioned that, some people say like, oh, get off all of the medication or whatever. How do you kind of advise or guide, obviously you know, just generalizing it, but for people who are nervous about that part of pregnancy or going into that part of pregnancy?
So I think if you can find a specialist, that's so important, because they can really help you with the most up-to-date evidence about the safety of medication. So if you're on a medication before pregnancy, sort of discussing the risks and benefits. And I think what we don't discuss enough, and I also want to mention that therapy here is also hugely important. Support systems are hugely important. It's not just medications, it's multifactorial. But I think what's really important to discuss is that there's actually risks to having untreated anxiety and depression during pregnancy, which we often don't talk about. We just think about the risk of, oh, an exposure to a medication to the baby, but we have to start to think about, and we have growing research that actually depression and anxiety can result in some outcomes like low birth weight or or early birth, early delivery, so preterm delivery, which can be really problematic.
So I mean, I think that in the video that I posted several times of yours that I think is so amazing.
Thank you.
Talks just so much about the hormone drop, which we've talked a lot about here on BDA Baby, but just, you know, bringing more awareness to that, because I feel like unless you've experienced it or seen somebody experience it, you don't quite grasp how dramatic that hormone drop is. You know that hormones are at play, but when you give birth and you go home after, you know, you go through this crazy life-changing experience and you're kind of sent home like, good luck.
Right. Bye.
And,
you're on your own.
Exactly. And then you are with a newborn and you're figuring out breastfeeding or how you're going to feed your child and sleep deprivation and a new dynamic in your home and your family. And then on top of that, you have this huge crash of hormones, which you talked about in the video, which I thought was so fascinating. And also talked about it being the biggest hormone drop that
Ever.
you will experience in your entire life. And then there's, of course, this, you know, very much this kind of like, okay, you have a baby now, like keep going. Everything's going to be fine. Put on a happy face. Can you talk a little bit about why that's like something that's not as known?
Yeah, you know, I'm not sure. I think there's a lot of normalizing because there is something called baby blues, which occurs to about 80% of people who give birth. And that is a 2-week period where there's sort of an up and down of emotions. You sort of feel like you're tearful for no reason. And then the next minute you're joyful. But that's very different than postpartum depression or anxiety. Like the difference with depression is that we start to see a hopelessness, a lot of functional impairment. And so I think there's a normalizing with baby blues is one part. And then the other is just, I'm even confused about what happens in hospitals sometimes. Like people literally have the biggest experience that their body has gone through, or they may even have a C-section, which is a huge surgery. And then they're sort of left to fend for themselves and their baby. And like, what other surgery in a hospital do you have to take care of another person? It's really a lot. It's pretty taxing on mothers. And I think in our culture, especially in the US, where families might live in different places and we're spread apart with COVID, especially, and there weren't as many support systems. You know, I do think mothers have to be taken care of in those days after birth. And in some cultures, you have 40 days of mom being taken care of and sort of family around you helping with babies. So I do think, you know, it's a little bit of American individualism. I think that's at play here, but we really need so much more support, and more support is actually one of the first items that I always talk about with my patients in terms of avoiding and minimizing some of these perinatal mood and anxiety disorders.
Yeah, because I wanted to talk about that. I mean, I'm currently pregnant, and I feel like, you know, when I had my daughter, I was, you know, it was at a time where COVID was kind of the thick of COVID. I definitely felt isolated, but I definitely found myself emotional from the hormone shift of like crying out of happiness, or, you know, sitting there and nursing my daughter and being like, I just can't believe this is so amazing. This is wonderful. That kind of a thing was definitely something that I was experiencing. But is there anything that you can do ahead of time your baby, having a good support system, of course, but anything else that you can do to prepare yourself or maybe increase your chances or decrease your chances of having postpartum depression?
So I really think it's about if you have a history of mental health issues, or if anyone in your family, like your mother or a sister, has had any kind of postpartum symptoms, know that you might be at an increased risk. And so in those cases, I say get in touch with someone that can help, a professional, just in case. Even if you're feeling great through the pregnancy, have someone just in case that you've already established care, because as you may know, mental health care is pretty difficult to get plugged into. So that's one thing that I think is important to kind of set up. Another thing is to be flexible about birth plans, for example. I like to call them birth preferences, because often I see when we're stuck on this idea of how we want to give birth exactly and plans deviate from that, I do see a lot of trauma around birth, and that is a risk factor for postpartum depression and anxiety. Support systems obviously are really important, but you mentioned breastfeeding. Breastfeeding is something that I think in our culture has swung in terms of the pendulum of telling moms that that's the only way to feed their babies, or that's the best way. But truly, I think we need more flexibility in this area as well. And if it's not working for you as an individual, if sleep deprivation, for some people, they can sort of deal with it. Other people, it can be really impactful in terms of their anxiety and depression. And sleep often is the first prescription that I give, because that can alleviate so many symptoms. And so when we think about the risk benefit, you can augment with formula and have your partner or someone else feed the baby at night. If for you getting 4 to 6 hours of sleep will change things and sort of help your mood and anxiety, it is worth that sort of risk to the baby, or, not giving them breast milk 24/7.
Is there anything you can do hormone wise? I mean, we talk a lot about, eating for your hormones, eating for your body, things like that. Are there specific things that you can be doing ahead of time to kind of gear up or prep for that big hormone drop that you've talked about that happens in that kind of 2-week frame after giving birth?
What's so interesting is that we still don't know that much about it. We just know that there's a huge swing in hormones, and for some people it's fine and they're able to navigate it, but other people are really acutely sensitive to those fluctuations. So things that you can do, always, I think, eat the rainbow is what I say: less processed food, less sugar. Sort of smaller meals throughout the day can always sustain you. And I do think that there is so much that we're still sort of learning and talking about in terms of food as truly prescriptions for mental health issues, for so many things. So I think a balanced diet, having some kind of physical activity can also be really important, and connection with others.
When is postpartum depression or postpartum anxiety? Because you were saying that 80% of women experience baby
blues, yeah.
More kind of has to do with kind of your hormones leveling off or dropping back off, and that's in the 2-week period after giving birth. But when it comes to postpartum depression and postpartum anxiety, what is the time frame for when that would appear, when you can say, like, I'm out of the woods, I'm not going to get it?
So unfortunately, it's not that easy, because some people have the baby blues, have a little resolution, and then maybe 3 months from then start to feel the symptoms. So really, we call the postpartum a year, but actually we don't have enough research to even sustain that. I think postpartum sometimes goes on further. But what we think is, after those 2 or 3 weeks, if the symptoms of baby blues seem to be sort of increasing, spilling over, we start to get, again, with depression, more functional impairment, difficulty connecting with the baby, issues around hopelessness, or just, I think for some people during baby blues, they're like, oh, gee, I have to wake up with this baby every 2 hours, but I know in a couple of months things will get better and the baby will sleep through the night, hopefully, or a couple of hours, and it'll be fine. When we start to see depression, we start to see a real lack of hopelessness about the future, sort of feeling like, oh man, maybe my baby would be better off with a different mom. Sort of some of those thoughts start to come up. So I think it's the quality that starts to change. But unfortunately, we do see some cases of people sort of getting through the first couple of months, and then maybe at 6 months, because weaning from breastfeeding is also a huge hormonal shift. So that can sometimes bring on some other mood and anxiety symptoms.
I also am just curious. I mean, you see obviously a ton of women who are going through a variety of different phases of fertility, of, having kids, being pregnant. And the past couple years during COVID have been an incredibly isolating time for everyone, especially for people who are having children and first time parents. And one of the kind of things that I think, where I can see for myself, that I always had looked forward to about having a baby and being pregnant for the first time when I was pregnant with my daughter, especially, was kind of like this idea of being around your friends and your family and kind of just soaking up all of this love.
Marking those episodes, right? Marking those really important times.
Yeah, exactly. And then especially relying on your friends and family postpartum to help. And that's not there for everybody, in general, but also, of course, especially during COVID when everybody's isolated and anxious about COVID with a newborn.
Yes.
Um, was there a huge increase in your postpartum depression, postpartum anxiety with the level of isolation people were experiencing?
Oh, absolutely. And it's actually, we have some research that also definitely anecdotally in my own practice, in sort of amongst my friends and myself. And I think certainly the data is starting to show that there has been an increase in postpartum anxiety and depression since COVID started. And I really do think that at the heart of that is that we are social beings, that we want to sort of socialize, that it's socializing is great for our mental health. And support systems are so integral to having sort of a smooth postpartum, and it's already eroded in the country. Like I said, many people live in different cities than their parents here, and we don't have that sort of community or way of, but it really takes a village when we think about successfully raising children. And by successfully, I mean that we are able to maintain our mental health and sort of provide a safe and loving environment for our children.
It's interesting because a lot of some of the questions that people asked were, how do you even know that you are someone that's struggling with something that's more than baby blues?
So I think a great way is thinking about, are you enjoying the things that you used to enjoy? Are you sort of feeling down most of the time? Are you not connecting with your baby as much as you sort of hope to, or are there feelings there of sort of not feeling so connected? Hopelessness, I think, is a huge one. Disruption in sleep, in appetite. And of course, what's difficult is that some of these are postpartum symptoms, right? Like, you're going to have a disruption of sleep with your
Right.
newborn, but when you're able to sleep and newborn is asleep, or someone else is taking care of them, are you still unable to sleep? So sort of a way to differentiate. Again, I really hope that people are able to get their partners or their or family to help them with food. But when you're offered food, when you're given food, are you just don't have an appetite? Those sort of things should give you an indication. And yes, there's a lot of stressors, COVID, financial stressors. But if you're feeling any of these things, it's important to get in contact with a support group, some professional help, because it can really make such a huge difference. The first couple of months are integral to your attachment with your baby, and being absent in those ways or feeling like not totally yourself can really interfere with that.
One of the things that I definitely felt after I had my daughter, and it was interesting because it came up several times with people's questions for this specific episode, was just the idea of like, why don't OBs talk to us about this? Like, why isn't this something that, like, oh, you're pregnant or you're thinking of getting pregnant? By the way, the
This
hormone,
might happen.
the hormones after, are really crazy for a lot of people, are really challenging. And it's not all, because I think you kind of think like, oh, of course you're going to be sleep deprived, but it's so much more than that. And I thought that it was interesting that several people had asked why OBs don't warn people ahead of time.
Yeah, so this is something I asked myself, and I actually do a lot of training to OBs in the local area in Los Angeles at Cedars and St. John's and Providence System because of this issue. So I actually think the training OB-GYNs have to learn so much. First of all, they do all of obstetrics, all of gynecology, and that's a 4-year residency. And unfortunately, like aspects of mental health for a lot of programs just aren't emphasized. And you have older generations of OB-GYNs that have absolutely like old evidence and sort of data about women during pregnancy. And I really do think there needs to be a better education of a lot of these physicians about it. So that's partially it. Also, and California actually just started to mandate that there has to be some sort of question during OB visits about postpartum anxiety or perinatal mood and anxiety disorders, which is a huge move. But I also think a lot of the OBs that I've talked to are intimidated because they're like, okay, yeah, they're depressed. Then what? It's impossible to find help and a therapist and professional help. So they're also sort of stuck with like, what do I do if I do get, sometimes it's difficult to ask a question that you don't have the answers to if they do say that they are depressed. So I think it's a huge sort of shift that we have to make in terms of OB-GYN education. And I think it's starting to happen, but it's going to be slow.
And is there something that we can do? I mean, as people who are, I know that I asked about if you're having a baby like myself, like how can you be preparing for that? But I mean, for people like my best friend just had a baby, how can we be better support systems? Because one of the things that I always hear from people who, have had kids before COVID was, oh, my friend came over to visit the baby or to help me with laundry, and they realized something was off, and they said something like, oh, yeah, I think you might be suffering from postpartum depression or anxiety. Why don't we get you some help? For a lot of people who are nervous about COVID still, that's not happening because no one's coming over to the house. So there is that big disconnect of, you're on your own, or you might be with your partner, your significant other, and that's it. Is there anything people can do knowing someone who might be giving birth to kind of help in that journey?
Yes, please ask them how they are. Give support in ways, that isn't, oh, how can I help you? Or what can that's another chore. Really say, oh, I'll go and do laundry, right? Like have some ideas for your sort of friend that's a mom. And if you aren't able to go over, I think talking, supporting, FaceTiming, and really asking mom how she is, because often what happens is that you're sort of the princess when you're pregnant and everyone's caring about you and asking about you, and then then you have your baby and it's like, all right, forget that person, and the focus is on the baby, and you feel like you're no longer that center of attention, but the baby is, and everyone's asking how the baby is. But really ask how mom is next time. I think that really is invaluable, and sort of listen and hear out what's happening before sort of giving advice. I think too often we try to problem solve when friends sort of tell us how they're feeling instead of just sort of listening and taking it in. But certainly if you sort of see the clues that there might be something else going on, I think gently highlighting it can be really important. And I think sometimes in the thick of it, people that aren't familiar with some of these symptoms have no idea what's happening and think that maybe it's normal.
So shifting gears a little bit to, a big part of your practice, which is people who are trying to conceive or on a fertility journey of some nature. I feel like there are so many of us who know someone who might be at some phase of their fertility journey, that they might be struggling, and you want to be supportive, but you're also a little bit unclear as to what to say or how to be helpful as a friend. Do you have any advice for how we can support people who are struggling with their fertility journey, or might benefit from seeing someone like yourself but don't necessarily have access to that?
Yes, I mean, I think that's so important. I'm so glad you brought it up because it is National Infertility Awareness Week. I think this is another part of sort of the reproductive world that is sort of overlooked. Infertility is a physical diagnosis, of course, but it's often one that's left with a lot of questions. 1/3 is female related, 1/3 is male related, and then a third is had no idea. So I think there's a lot of open questions, and what we see in some of the research is that actually this diagnosis of infertility can cause serious distress in patients that's similar to a diagnosis of HIV or cancer. So I do think that the increased levels of anxiety and depression are sometimes overlooked. And, you know, I think people start to focus so much if they decide to do IVF on like getting a baby, whether it's IVF or adoption, but not really checking in with how they're feeling about all of this. And, you know, I think the assisted reproductive world is a phenomenal use of technology. There's things that we couldn't do, you know, 50 years ago, and making people sort of be able to have the families they want. But I do think that the mental health care aspect, it can be really grueling in a lot of ways. So I think get some education. If your friend is dealing with this, talk to them, listen, right? Instead of proposing things or giving recommendations about what they can do. And certainly can be really tricky when you're pregnant and you have a friend who's struggling with fertility. And for that, I say, you know, be open as much as you can directly with them. Tell them the news that you're pregnant, maybe in a private setting, so they have time to sort of digest it, not, you know, not at a party where they can sort of see everything. And also for the people that are going through the fertility issue, it's okay to feel like it's unfair, to have grief over it, right? To think like, man, how come it's so easy for her and it's taken me a year to get pregnant? I think normalizing all those things, and also, you know, when you share with your friends, you know, support, listen, try not to give advice. Certainly don't complain about your sort of situation during pregnancy, because that can be often difficult. But I do think that there's ways for us to decrease the stigma. And also, you know, 10% of women in this country deal with this, 1 in 8 couples. This is not a rare occurrence. This is quite sort of prevalent. And I do think we need to talk more about the mental health implications.
Yeah, no, I totally agree. I think when people are able to be open about their experience with fertility or their choices with fertility, it really helps so many people. And we've definitely seen that here on BDA Baby. So I totally agree with that. Before we wrap up, I think it's always really helpful to be able to give people some guidance when it comes to resources or support groups. Obviously, your account is incredible, and I repost it a lot just because I think it's really simple, straight to the point, and speaks to the issues that are so important, which are, you know, hormones, infertility, postpartum anxiety, how you can help as a friend, a support person. But are there other places we can direct people that might be wanting to have knowledge for themselves going through it, or just prepare themselves ahead of time?
So I think there are some really great resources. I really love Postpartum Support International, and they're a great resource. They actually have some online support groups, so that can be sort of the first, and they're free, the first sort of attempt that you have at a support group, or sort of meeting other people that might be going through similar experiences. They also have a directory, which is wonderful, all over the country for people who have mental health, maternal mental health care certification, which I think is great. There's also, you know, wonderful accounts on Instagram, which I'm sure you know about. Dr. Jen Schwartz is or Jen Schwartz is wonderful. There's Mom in Mind, which is really great. I think another resource that I think is absolutely wonderful, it is a little bit more research driven, is the Massachusetts General Hospital maternal mental health website. And they're actually in the forefront, one of the first programs, I think, along with Columbia and reproductive mental health. And they have some wonderful articles where they break down some of the research sort of in lay terms, and it makes it a little bit easier to digest. But if you're interested in sort of more research, that's a really great website. And there's a couple more, maybe I'll share them with you. I can't think of them, but there's definitely places where you can look up the safety of medications, talk to experts, but PSI is definitely one to start with. And the MGH website is wonderful as well.
Amazing. And we'll make sure to link all of that in the caption of this video when I repost the video, because I think that's always really helpful for people, because it is a lot of information, and I think people are really curious and eager to be able to be helpful and be armed with knowledge, but being able to have places to turn and support groups is always really helpful and awesome.
Yes. And, you know, we mentioned a lot about the birthing parent, but also non-birthing parents, including dads, can also have postpartum symptoms. So important to check in with them as well.
Yeah, that is a big thing that actually I read about in a book right before I had my daughter. And I was like, I didn't even know it was a thing.
I know.
I made sure to be very mindful and constantly check in with my husband when I had my daughter. And it was just, it's such an interesting thing that we don't talk about is um, the partner's feeling or adjustment to life with a newborn. And they might not be having the same hormone shift or healing process that you're having, but it is something new and something different, and they're also sleep deprived, so we can be looking out for that. But
Yes.
all this information will be in the BDA Baby newsletter, so if anyone has not signed up for it, you can click the link in my bio. We'll put all the info to Dr. Sarah's page and everything that you are doing, which is all amazing. And I'll probably repost that video again 10 more times.
Thank you. Okay.
So helpful. Thank you so much.
I appreciate it.
Thank you. I appreciate you. Bye.